When you open up your schedule for the day and you see that you're treating someone that has scapular winging, what do you first think about? Do you think about serratus anterior weakness? Do you think about scapular muscle tightness? Or do you think about long thoracic nerve dysfunction? Now, these probably play a contributing role to the bigger picture. However, I feel that we prematurely blame them and we get hyper-focused on these symptoms compared to treating and trying to fix the source. So in this video, we're going to talk about how a posturally driven scapular winging occurs and where the source is coming from and how we can start to fix the source so that we're always fixing the symptoms. Before we discuss this posturally driven pattern, let's understand the basics of scapular winging. When we visually look at a winged medial border of the scapula, we are looking at an internally rotated position of that scapula. Now, what I find is that a lot of us do a really good job at understanding and visualizing protraction, retraction, anterior, posterior tilting of the scapula, but have a hard time with external and internal rotation. An easy way to remember this is internal rotation is essentially winging of the scapula, but you can also think of a gate or a door that's being opened. And the varying amounts of a winged scapula are the varying degrees of how much that gate or door is opened. Conversely, external rotation is where we're more congruent with the rib cage. This would be synonymous with the gate or the door being completely closed. Now, this is important to understand because a winged scapula is an internally rotated positional dysfunction, okay? So what's happening is we don't have congruency between the rib cage and the scapula. And that's a big deal because in order to achieve full overhead, pain-free range of motion, we need congruency to allow for protraction and upward rotation and a posterior tilt of the scapula. Now, if you're familiar with anatomy, this is part of the reason why the serratus anterior is quick to blame. And there's definitely blaming to be done, but I don't think it needs the full amount that we typically do. Now, the serratus anterior protracts and helps with upward rotation of that. So it's really easy to see that visual dysfunction between the rib cage and the scapula and think you have to start with the serratus. Instead, in this video, we are going to discuss that maybe the serratus or maybe the scapula didn't move away from the rib cage. Maybe the rib cage or the thorax moved away from the scapula. So it's no secret that most of our patients don't have perfect upright posture. Now, I would argue that's a good thing because upright posture is not that great. Slouching is not that great. The best posture is one that someone can move in and out of. It's the variable movement that keeps people out of pain. However, there are natural asymmetries and natural human tendencies that produce postural deviations. Now, how many of you have worked with a patient that has a shoulder lower on one side compared to the other? How many have some degree of rotation, right? And that will show through your appendicular testing. But what I want you to understand is that there are natural asymmetries. And when we have a shoulder that's lower than the right, there's usually a varying degree of rotation. Now, why does this matter when we're talking about scapular winging, right? Well, there's a direct consequence at the scapula because of this postural deviation. So let's talk about it. To better understand how scapular winging happens from this postural pattern, I want you to stand up and try this drill. Now, we're going to move through bigger motions so that you can feel it. Just know that we are exaggerating for the example purpose. Now, when you're in this position, I want you to drop your right side so it's lower than your left. I want you to come forward a little bit, and then I want you to rotate to the left and then internally rotate your arms, okay? Now, as I turn towards the camera, do you think my body's going to try to keep me here? Right? It's going to start to fight to bring me back to a neutral position. Now, what's the easiest way to do it? If I have a stiff spine, do you think my spine's going to want to do it? Probably not. It's too stiff. What's not stiff in a lot of people is the humerus. So what the human body can do at an attempt to get more upright is find external rotation. We externally rotate the humerus, and as we do that, it pulls us into a little bit more of an upright position. However, there's a consequence from the external rotation when it's really just driven through the humerus as a compensatory means. We have more of an internally rotated position of the scapula as the consequence. Remember, back to our biomechanics of the scapula. Internal rotation, the gates are open, the scapula is now winging. So, because the thorax is compressed forward and turned away, the scapula is following, right? The scapula always follows the rib cage and the spine because that's our core, that's our axial skeleton. So when we have a compressed forward and rotated position causing an internally rotated visual of the scapula, we are always going to think that the serratus is weak, right? But what happens if you start to get the rib cage and move it back? When you start moving back, you start to increase that congruency, and then you can properly strengthen the serratus. So the key is, I don't want you to not strengthen the serratus. I just want you to make sure that you have congruency before you start strengthening the serratus. In the position of an internally rotated scapula, the serratus has no option but to be weak, right? There's a disconnect, all the muscles are elongated, we're in a really weakened eccentric position. So, although this approach seems different, it's really not. The only big difference is we're making sure we have congruency before we start adding strengthening exercises. The first strategy we'll use to improve that congruency is respiration reaching drills, right? So we are reaching, aka serratus stuff, but we're using respiration as a key player. Why? Respiration, when done specifically, can start to open and increase areas, right? So we talked about the compression, the overcompression tightness of that side that's down and forward, right? So what we need to do is get it down and back. Well, we need to start getting the rib cage to pull back, and then we need to start breathing in there. Once we do that, we get that space we need and that congruency we need to then add our strengthening exercises. So when it comes to respiration drills, there's a wrong way and a right way to do it. And these exercises have gained a lot of popularity, which is great. But a lot of times the intent is correct, but the execution is incorrect. So when it comes to respiration drills, specifically to get the rib cage back and to activate that serratus, right? Because we're getting the rib cage back in a better position to then start adding strength to that serratus. The wrong way of doing it is over protracting. Why? When we go into an over protracting state, we are just lengthening and eccentrically orienting those muscles. We're kind of opening the gates, so to speak, and we're biasing a little bit more of that internally rotated position of the scapula. So we really need to ensure that when we are doing our breathing reaching drills, that we are thinking and referencing the sternum moving posteriorly towards the scapula with minimal rounding of the shoulders. So the wrong way, it produces a lot of protraction and rounding of the shoulders, like this. The correct way keeps those shoulders in the right position. It's more about the sternum moving back. And from there, then we start adding in our breathing and maintain that serratus activation. So now that we understand why we need to position better, get the rib cage back, and then get the serratus on, we can then start going into more strengthening exercises. Now, instead of just thinking locally at the symptom, keep the global mindset, okay? So go back to the pattern, right? Remember, this is not just a scapular problem. This is a pattern or postural problem. So we gave the example of a right shoulder that's down and left rotation. What happens as a consequence at the rib cage is a lot of compression on the right, internal rotation, and a lot of expansion or external rotation on the left. So as we start to address scapular winging, a really great exercise is a side plank to reverse this posture. When we do the side plank, we're only doing it on the left, right? Why? Think of that we're trying to catch the left up to the right. The right is already overactive, the left is underactive. We just need to start to switch this. So we're starting to prescribe a left side plank, but then we can get even more specific, a left side plank, and then we could start to have a extension moment at the humerus to get the low trap and to get the long head of the triceps. A lot of people forget that the long head of the triceps inserts onto the scapula. These become really weak because of our postural deviations. So the serratus, we already know, is a big time muscle, but now I want you to start thinking low trap to help bring that back so we get our posterior tilt, our upward rotation, but also the long head of the triceps in conjunction to the left obliques to continue to address the postural deviation. So now that we understand the why as to our thought process and our execution, let's go over these exercises so that you can start to prescribe them, and more specifically, prescribe them with the right intent. Quadruped is a great starting position to help your patient move their sternum and thorax back. When you're in this position, help your patient understand their 0, 50, and 100% so that they can appropriately protract while minimizing the shoulders. Once they achieve that, we can cue them head down, bring the sternum slightly up, slight tuck of the tailbone, and from there we breathe while keeping the serratus on. Our next exercise is a wall side plank. First, press down through your left elbow to engage your left scapular muscles. Then take your contralateral arm and elevate the rib cage while the sternum goes slightly back from a posterior pelvic tilt. From there, take your right arm and place it against the wall, pushing it back to engage your triceps and the low trap. This will help you with turning to the right and engaging those muscles. From there, take 4 to 5 breaths as your hip is in the air. A more dynamic exercise would be a bear crawl. When you do this, you want to make sure you don't over-round, and you want to make sure that you're maintaining the serratus activation. You can also do a reverse bear crawl that helps with that upward rotation of the scapula if you can maintain the proper amount of serratus.